Good morning. Hi, I'm Missy Pudamat from CSG, and we're here as part of CSG University's Spotlight On program. Today we are featuring Dr. Bob Ericksen, who is our clinical psychologist medical director here at CSG, who has just done a wonderful presentation for us on post-traumatic stress disorder. Dr. Ericksen, how are you today? And thank you for joining us.
Thank you very much. I really appreciate being here.
Okay, so if we could just do a little overview on what is post-traumatic stress disorder and what types of experience trigger this condition?
Well, post-traumatic stress disorder is a very, very significant psychological, psychiatric disorder because of its intensity, because of the symptoms that are manifested when you have PTSD. It's a very global, involves every aspect of our thinking and feeling, emotional and cognitive and neurological centers of the brain. And it's very dramatic. When an individual has PTSD, it can be very, very debilitating. And some of the symptoms that they will show are anxiety, nightmares, difficulty sleeping, intrusive thoughts of the incident that occurred. They'll constantly be replaying it in their mind. They'll have feelings that they're no longer themselves, that something is going wrong with them, that they're going crazy, they've never felt this way. Also, they will begin to feel a sense of a need to withdraw, because what happens is, and this kind of relates to PTSD, the issue of what causes it, when the stress occurs, whether it's an assault or an auto accident or some very traumatic incident that occurs that you observe, it doesn't just have to happen to you, you can also observe it. The reaction that you have incorporates all the stimuli that are going on around the incident. So for example, if you have an auto accident and you're on the highway on a rainy day, you wind up feeling very anxious on a rainy day, even if you're not driving. Or you may be able to still drive, but if you get on the highway, you suddenly have a panic attack, a reaction, and say, I can't do this, I can't drive on the highway, because the incident has become hardwired, so to speak, into our nervous system, into our psychological state. And the stimuli that occur around the incident also begin to kick off the same reaction.
And these are indeed the types of claims that we are seeing and reviewing here at CSG, both motor vehicle accidents and for workers' comp, correct?
Absolutely. For motor vehicle accidents, certainly the accidents that occur, the injuries people sustain. In many cases, it's the trauma also of they're bleeding, they see other people injured, they may have a loved one in the car with them. All of these trauma begin to be incorporated and really solidify in the individual. And they may not recognize it right away. It may happen days, weeks later that they begin to experience these symptoms of anxiety, of panic, of recollection, of nightmares. And with workers' comp, we do also oversee the care of police officers or individuals who are driving trucks or cars for their particular employer. They get in an accident, or a police officer perhaps is in a traumatic situation, domestic dispute, or actually a shootout. We've had situations such as that, and later on they begin to experience the symptoms of PTSD that I just described.
What types of treatment are most common with PTSD, and how effective are they?
Well, the most common treatment, the most effective treatment, and the most common now, which is very nice to see, because there's really been a developing knowledge and technology to address PTSD, is what we call cognitive behavior therapy. And it's a very specific therapy, it's a very structured therapy, where the individual in a very supportive therapeutic environment is really guided to reconfront the traumatic incident and the stimuli that occurred around it, but in a therapeutic setting, so that they can reprocess it and reduce the impact that it's been having on them, or the impact that stimuli associated with the incident, even though they might have been neutral before, now kick off in them. Along with that, we have psychotropic medication, of course. It might be an antidepressant or an anti-anxiety medication that's used in concert with or in coordination with cognitive behavior therapy to help reprocess, really, the experience, that the individual can begin to function again. And I just might add very quickly, it's not that the individual totally overcomes all the symptoms, because it's almost like scar tissue, emotional scar tissue, but you can heal, and you can learn to cope, and you can learn that when you begin to have these reactions again, maybe even months after the incident and months after your treatment, you know what to do. You have coping skills that you've been taught in what we call stress management and stress inoculation, so that when you confront the incident again, you can stay on top of it and understand what's happening to you, why it's happening to you, and that there are coping skills and techniques you can use to help you through it.
Very good.
And continue to function.
And family members, I understand that in some of these cases we treat family members as well?
Absolutely. Family members are often very important because very few psychological or psychiatric issues occur in a vacuum. Usually it is with a family member. It's a spouse, it's a child, it's a parent. And the family are impacted upon it because the individual, of course, is not what they were before as a result of the incident. And so they need help also to understand what's happened, to understand what their role can be in helping the individual recover, and to help them understand that, yes, recovery is possible, but the therapists who are involved with the patient as well as the family help the family to also help the patient in terms of providing a therapeutic.
They need a strong support system.
Support system and therapeutic environment, because that's really who they go home to. They go home to the family. And when the family understands what happened, often they can become much more supportive because all they know is, what's happened to my husband? What's happened to my wife? I mean, why are you crying all the time? Why can't you get out of bed? Why are you having these nightmares? How come you can't function? What do you mean you can't drive anymore? I'm going to have to drive you everywhere. These are real issues. And so the family has to be addressed also, and the impact of the PTSD on them.
What types of misconceptions are there out there about PTSD? I know maybe it's a word often used, an acronym often used, and certainly in many circles. So.
Well, yes, and I must say, PTSD is becoming much more topical today because of all that's been happening. Which I don't know, we have to recount all of it, but Sandy Hook, obviously, or even the Sandy storm, superstorm, and the effects on people. The misconceptions that are most common are, first of all, what is this? Is this real? I mean, can't you snap out of this? Can't you get over this? I know this happened and it was really hard, but shouldn't you be over this by now? A week, 2 weeks, a month later? Is this a real condition? I mean, I just don't understand what's happening to you. Or it can be, and in some cases it goes another way. It goes, this has happened to me now. I can never drive again. I'll never get better. I'm changed forever. I'll always be a mess. And so you have that kind of response too, the misconception that now that this has happened to me, I can't ever be happy again. I can't ever function again. This will be part of me all my life, and it will debilitate me all my life. And again, there you have to give the patient hope and point out in a very structured way in the therapy that there is hope, there are techniques available to help them to recover from this and to function.
Great. Well, I thank you again for your time on this very important topic. It was wonderful having you here. Thank you again, and have a great day.
Thank you.